So today we are going to discuss two different products. The first one is Care in Motion. Care in Motion is a very basic software and hardware as well for recording your simulation session. And I'm sharing already my screen now, so you can see from the screen that we have on the left side that let me just see. As you can see from now we have 3 camera connected. I will just switch to my mobile camera now, just to first I would like to go for the hardware. As you can see, the hardware is quite basic. We have the laptop that we are going to use for the software, where we will manage all the cameras and everything. And we have the cameras. Exactly, we have 3 of these cameras, and we have the vital signs, which is connected and captured also by the software. And over there you can see the box for the whole unit. It's a very small box. It's portable. You can take it anywhere with you. It's very easy to move, and that's why it's very portable solution for everyone. Okay, let's stop this camera. Okay. So I will go like section by section for the software. As you can see, on the left side we will have here just the numbers for the connected simulators. We don't have to do anything. This is like giving you notification about how many virtual monitors is connected, how many cameras, what is the number of the recorded session, and the simulators connected to this software. As we can see here, we have 3 cameras connected, one showing the vital signs for the fetal, and one showing this stretcher and from inside our OSCE room, and the last one is directed to the mannequins. As I said, cameras are totally portable and totally wireless, so you can move it easily and you can capture whatever you want. And it is also mentioned here virtual monitors 1, which is this monitor, and it is connected to the patient monitors from Gaumard to capture the vital signs. So at the end of the session, we will be able to see the camera recording and the vital signs. So we will see the actions for the students, for the trainee, and it is synchronized also with the vital signs. So I can compare fairly if this was the right action or not. Okay, if we go to the top now, so we finished this side. If we go to the top, here we will have the live, which is before the session, it shows you exactly like the camera positioning, which is I'm using now on live. Here, if you press on the session, it's going to move you to the last recorded one, the last recorded session. And from here, from this drop down, you can select the rooms, and you can add different rooms to the software, and you can select, because this is portable solution, so you can add different rooms and different name for the rooms, and you will keep moving the units from one room to another. So we just finished this as well. If we would like to start any recording, we will be able to start the recording from this bottom. If we just press this one. So now we have started already to record the simulation session or whatever is going on. And also we have the feature of adding annotation to the videos. What annotations means, or what we can use the annotation for. Annotation is just if you have a very long video and you don't have to go for debriefing for like 30 minutes or 40 minutes video, so you can add those highlights on the recording, and at the debriefing you will be able to jump directly to these important highlights on your video. So this is like it's saving you time, and it is also editable, so you can add your own annotation. This is the one that I just added, but you can add your own. Okay, Here I will add another annotation, for example, this, and I will just do, so now we recorded almost 1 minute, so I will stop the recording now, and after just stopping the recording, it will give you the option for naming the session. So let's say this is demo test session 1, and here if I selected live, I will go back to the live, so I will be able to see the cameras again. If I selected session, it will take me to the debriefing. So I will move to the session. Okay, and from here you can play back your recorded session, and as you can see, there is 2 dots here, the green one and the red one, highlighting the annotation that we have added. So for example, for this video, it's 1 minute, so you don't have to go through it all, but if it's 1 minute, it's okay, it's easy. But consider, like, sometimes the recording is going for 20 minutes, 25 minutes, you have different session and you want to move it faster, so you will be able to jump to the annotation. If we play it back now, so this is what we have recorded already, I will be able to just jump to those annotation if I want. Okay, and also here on the side, as you can see, like you have the, if we selected view details, we can see exactly what annotation we added and in which second or minute exactly. So these are the details for the session, the date and the timing, and how long is the session, and how many annotations we have added. And it is also highlighted here the name for the annotation, because if we like stand here, it will not show the name, but on the left side it will be shown on the left side. Okay, so now I will go back to live. This is what we normally, our like first screen. Then I will be moving now to the features from here. From here we can, from the tools side, we do 2 different things. First of all, manage annotation, as I said, and from here we can add a group for annotation. So we can add, like, for example, if we need to add a new group, for example, we'll call it emergency. Okay, and then we can select a color for this group. And then also you can select an icon for this. Let's say we'll make it like this, and I will rename it, sorry, because of the medication. Okay, then I will be able to add new group. Okay, so this is like the main group. Inside this group, I will be able to add like a different annotation. This one has now only one, but I mean, like, if I edit it, like, I will be able to add different annotation inside this one, like here, medication given. Okay, and then I will save it. If I go back to annotation, now you can see that I have added another one. So before we had the debriefing, the test, the ICU, now we have the medication one. Okay, so this is from where we add the new annotation group. If we go to manage session, this is where all the recording that we did will be available. So you can come here for debriefing. Okay, so you can just select the session and you can click debrief, then you'll be able to play back the video. Or we can, from here as well, we have two important features. One is import and export. So I can get like cases from outside this computer and load it to the computer and take it to the system. And also I can do the opposite. I can take some cases out of the system. So I can save the videos on the, for example, the desktop, and I will be able to take it on a USB or something. And also I have the archive feature. So if I have like very old session and I don't need it anymore, I can move it to the archiving. And if I move to archive here, I will see all the archived session already. Okay, so we have active session, we have archived session. From the active session, if I selected any of them and I will move to archive, it will be moved to this archive site. Okay. From here, I can also, now we finished the tools, I will move to the setup. We can here add the rooms. And as I said, you can add many rooms, up to 20 rooms. Here we have added already 4 rooms. I can add new room from here. I can name it, for example, in ICU. Okay. In ICU. Okay, it is enabled room. And I can from here, so now we have added a new room. Then the room name is in ICU. And here, the system is telling you how many cameras are available to be added to this room. So not every time I will need 3 cameras, but they are all available because they are all connected to the system. Then I will start adding them. I will add this, this, and that. So now we have the 3 cameras. Okay, and then I will save my room. Okay, so the room is already added in ICU, and it will have like 3 cameras to be recorded. The room, you can make the room enabled, so it will be active, you can see it, or you can make it, if you just press this one, it will be disabled, so it will not be shown for you. Okay? And also you can select the clown for the room, it's like the copy, if you want. Okay, so now we finished adding the room. The room is already added to the list of the rooms in ICU. Then when I go to live now, if I want to do recording in this room, I can like select it from here in ICU. So I will be able to use this. Moving forward, here you can add other devices like different cameras, if you want to connect the cameras, if you want to connect speaker or microphones. So this is like the section where we will be able to add new hardware to the system. And here here you have some configuration and preferences. So you can select like to do auto archiving. So the session that will be, for example, if I activated this, the session that will be press edit. Auto archiving, it means like after, for example, if we set this for 30 days, so any session that stays in the system for 30 days, it will move to archive file after 30 days. I can like keep it on or off, and this is like the session settings from the configuration. Also, you can select for the delete option if you want to auto delete, like after 30 days the session will be deleted. Also, you can do it from here. You can set your own preference as well, show your user annotation and show uni annotation as well. So these are the preference for the configuration. For the user management, from here I can create new user. Okay, so now you can see that there is only one user added to the system, but you can create many users. So if this, as we said, portable solution, and it will be moved from department to department, so you can create a new user for each department from this side. user profile. Yeah, this is the profile for each one. So where you can see this is the current profile, which is the admin. You can check the password, edit the password, and stuff like this. I think we have covered everything. As we said, it's quite simple software. So if you have any question for that part, just let me know before moving to the other section. Any questions so far for this, for the carry motion?
Is it connectable to any type of simulator, like high fidelity, low fidelity, other types of simulation?
Yeah, it can be used as a standalone. If you for the simulator itself, it is connected to high fidelity simulators to get the vital signs. So it can be connected, as you can see now on the screen. It is connected now with the Victoria, and we are capturing the vital signs for this. So it is connectable with the Gaumard simulators, and we can do the capturing for the vital signs.
Thank you.
You're welcome.
Mahmoud, yes. How many sessions can be saved? I mean, the size for
As you can see, yeah, this is like the space that you are having. So whenever you add a new session, it will start like filling in the free space here. So I think this is a good indication that you will have it in front of you. And from the configuration, you can set like to do the auto delete or the auto archiving just to keep this space available all the time. So but this, I mean, like you will have to monitor it for a while after using the system, and then you will be able to decide maybe it's enough for you, maybe not, but then you will need to see this archiving or deleting features.
Thanks.
Any other questions? Okay, so now I will just stop sharing from here, and I will be moving to So now I will be moving to the virtual patient from Gaumard. This can be used as a standalone system for SP or OSCE examination, and also it can be integrated with the simulators. I will be going through the software first. This is the Omni2 software. We will go through it, and then we will show you the changes from the software and how it will be reflected on the virtual patient point. As you can see on the top left side, we have the favorites. So these favorites, exactly what you can see in front of you, like the respiratory rate, the oxygen saturation, heart rate, all of these things. So this favorite list is the easy access for you, or the things that you are using the most during your session. So you will be able, just with a small click like this, you will be able to increase or decrease the parameters that you would like to do, and you can reflect it on the screen as well. From where we can add to this favorite screen, if we move to the other tab, which is vitals, as you can see, from here, if we did the plus sign, this will be added to the favorite. So for example, respiratory rate, it's showing minus, which means it's already added to the vitals rate. So if I would like to add, for example, now respiratory pattern, so I will click plus. If I went back to the favorite, I will be able to see it. So it is added on the top left side, as you can see, the respiratory pattern. Okay. So from here, from this vitals, also I can do changes that I would like to do, and I will be able to save it. If we log down, I will be able to press this and save it as a ballot. Ballot, it means like lots of changes that I can do to the simulator at once. And any of the changes that I would like to do now, for example, if I would like to do changes in the oxygen saturation, it's the same as from the favorite. I will be able just to do it by the sliding bar or by the plus or minus inches. Okay. So this is like for the quick changes, and as I said, I can do like lots of changes at the same time, and I will be able to save it and name it as a ballot. So for example, I will like select now add new. And then if I press save, I will be able to save this as a new ballot. For example, I will call it avenue, and I will be able to save it now. So whenever I need to reflect those vitals, I will be able to get it from the ballot side. We will get to this later on, where you can select the ballot and reflect it on the one. Moving forward, I will be moving to the CPR now, and this is one for automated CPR monitoring. So as we all know, all the standard now is totally changing every now and then. So it is required that you have an automated reporting for the CPR to guarantee the same quality and to guarantee like getting report at the end. So no more manual count. So for this, I will be able also, if there is a changes from time to time, I will be able to change the setting from the software, and I will be able to match whatever the standard or the new settings coming out every now and then. If you can see here, we have the compression rate, we have the compression depth, we have the ventilation duration, and the ventilation speed as well. And we have on the top, if we can see, this is the no flow time, the interruption time, so it will be counted as well once we start the session. From here, I will be able, if we lock down, I will be able to select the metronome. This is mainly, as you can hear now, it is guiding mechanism for the students where they can follow the sound, and when the sound changes, they will move from the compression to the ventilation. So this is, it is like coaching mode. And also from down, if we look to the start, so from here I will be able to start a new session. And as you can see now, the no flow time started to count, but because we don't do any action on the simulator now, so nothing is being shown on the compression rate or the compression depth, but it will be counted and recorded. Once we hit the stop, if we finish the session, I will get a report like this. So I will be able to add also compression before nearby. I can add different things. For example, I am the one who did the compression, so I will add maybe ventilation is done by Sherbert, so I will add his name. And at the end, I will be able to save the report and take it for revision or take it for grading or whatever. So this will be saved as report for this one. Moving forward to the scenario, even if it's easy and very simple software, but also we can create not only ballots, but we can create full scenario from this one. So if I move to the scenario side, I will be able to load scenarios. If we have the rest of scenarios from here, I can add new scenarios, create scenarios from scratch, and also I can use our own ballots. If we go to at the top, we have this ballot. So I will be able to select the ballots and load it to add it to a scenario or just load it directly to the simulation. So now I will be selecting the ballots. I will just do the bracket. Okay, so if we get back to the vitals, we can see all the vitals that change it back to normal, although it was an aberration. On the top right side, we have the settings. Okay, and here just can be used for this is the most important part for you, where you can add the parameters for the compression and the inflation. So if whatever happened, like the AHA come out with the new parameters, you will be able to come here and change it one by one. So the simulator will cope with all the changes coming out from AHA. Also from here, you can just connect to the virtual monitor, set up the Bluetooth connection with the simulators. We have also the feature of reporting. So this is the last report that I did. And also it has two different types of reporting. One for the CPR, this is the exact one that I just did. I can open it because it is saved as PDF. And also it will have the log report. Log report is the other report that we get out when we have a scenario based session on the simulator. Okay, so it will be listed here. Also, you can just select it and open it as PDF. Okay. Yeah, here on the top side as well, after the settings, we have this sign and it is the log. This is the log means everything that we did on the simulator, it will be recorded and can be saved as a report at the end to be used for debriefing and for revision. So any changes that we did today, as you can see, like we have changed the respiratory rate and we have selected the healthy ballot to be applied at the end. So everything will be recorded and saved from this log. Moving forward from the same side, top right side, we have this screen. This is like for easy evaluation and easy notes that I can add. So for example, if I just press the green correct the right sign, this means that the trainee just did a satisfactory or good action, and instead of just type that what they did, I just put this mark. When I go to the log or the report at the end, I will be able to see it that it was a satisfactory action from them. And the flag, it means unsatisfactory. I can also add whatever they are going to do. For example, they did, for example, remove the airway obstruction. Instead of writing this, I can select it from here from the menu, and it will be added to the log or to the report at the end. Okay. And the last one, as I said, these are the ballots. I can select whatever I want from here. I can load it. All the parameters will be reflected, and we can create new ballots from scratch, as we mentioned in the beginning. Okay. Now I will be switching to show you how the changes will be reflected on the vitals. So I will stop sharing this screen and I will focus on the vitals. So now we will be able just to do the changes from the Omni software, and it will be reflected on the virtual patient monitor. So now I'm going to reflect the changes on the respiratory rate. And as you can see, I'm gonna move it to be 30, and I will hit apply now. You can see on the virtual patient monitor that it is going to be changed as well. Okay, so from here you can do all the changes for everything. You can also turn off, I mean, like sometimes the patient arrived and then they have to attach the sensor. So from the software as well, I can turn off all the sensors. Okay, so for example, now I will do the same like for ECG, for example, I will turn it off. So on the monitor now you can see that it's not available. So once they connect the sensors, I will be able to turn it on again. So this is like one of the features that we are having in the software. So once the patient arrived and then they start connecting sensor by sensor, I will start turning it on one by one as well. Okay. Moving to the monitor itself, we have the feature of setting the, from here we can set the beep as well. So this is like, if you can hear it now. Okay, and also I will turn it off now. So, and also we can set the alarm. So what is the alarm for? I can set that the screen is going to give me, or software is going to give me an alarm if the heart rate goes below a certain number or go above a certain number. So from here, if I selected low 50 and high 120 as well, I'll select default alarm and I will make it like this. So now the alarm should goes on if the heart rate is higher than 120, which is now is 140. So once I click OK, the alarm should start, as you can see now. Okay, so this is how you can set the alarm as well. So I will put it, you can put it to silence if it's very annoying. What else we can do from the virtual monitor? I can, as a student, I can go there and I can from here I can ask for, if I'm the trainee or the student, I can go here and I can ask for any patient report, any X-ray, MRI, and I can send it to the instructor to send it to me. So based on the vitals that I'm having now, maybe I need to get any lab result or something, so I can, or MRI or whatever, so I can send it to the instructor. So MRI needed, and then I will send it. So the instructor will receive it on the software as well, and they will send it back to me, the report or the picture that is available. Okay. From the virtual monitor as well, we can also do the shock here. So as you can see, you can just increase the joules. So for example, now let me set the patient for VFAB. Then we will be able to do this. Yeah, now. Okay, so as you can see from the monitor now that we have selected a different palette for a VFAB patient, and we will be able now to give a shock therapy. So let's say we'll start with 80, then I will charge, and then I will give the shock. Okay. On my tablet as an instructor for the Omni 2, I will receive that one shock is detected for this patient and the shock is 80 joules. Do I need to get the patient to the normal sinus rhythm or not? Then I will say, I can as an instructor say yes or no. So this is one of the things that I can do. If I said no, maybe they will need to go for another shock. If I said yes, then the patient will get back to normal sinus rhythm. I said yes in such case. And if you monitor the waveform now, it starts to get like back to normal sinus rhythm patients. Okay. What else I can do from here? We have the ACG waveform. So this is like a detailed ACG graph where I can print it for this session, or I can save it as well. I can play it. So this is like mainly for ACG training. And you can get it printed and you can save it as well from the software. Any questions so far for this? Hello?
Yes, so does this work as 100% standalone? And like, how can you connect the tablet to the computer, and so without mannequin?
Yeah, it is, as I mentioned in the beginning, it can be used for SB, or it can be used like for OSCE setup if you want to just do something with the vitals only, focusing on the vitals and like doing changes on the vitals. And it is also can be connected with simulation. So it can be used for both different type of scenarios, and also as a standalone system for whatever, SB, OSCE, whatever you want.
So it connects with Bluetooth, or how did you connect the tablet to the monitor?
Okay, you have two types of connection. It's either by the Wi-Fi connection or by Bluetooth connection.
And like, how would you range your prices? Is it like expensive, or so for the standalone average prices? Because you know there are so many systems, some are really expensive, and so how do you rate your prices for this system?
Yeah, but for what you are getting, I think it's in a good range for in competition with the other products available. Especially for this one, as I said, it's not only can be used as a standalone, but can be used also when it's connected with the simulator. And I don't think that this feature is available in some of the other products. The other products, it just can be used as a standalone system, showing the vital signs only, and that's it. But with this solution, it has like it's a multi-purpose, so it can be used for different purposes.
Thank you.
You are welcome. Any other questions from before moving to the last?
It could be bought as a license only, right, without the need for hardware.
Yeah, you can get the license and install it in your computer.
Thank you.
You're welcome. So now I will be moving to the last section where we will do, like as we said, it is also can be connected for with simulator for the delivery, where we will be able to focus on the fetal heart rate and TOCO as well. So if we look on the right corner, we will find the screen captures for the fetal heart rate and the TOCO. And from the software, we will be able also to change these parameters. So for example, now we have the contraction duration. I can change it like to be for, now it's 40 seconds. Now I will change it to be 30. I can change the contraction intensity, so I will increase it, so you will see it reflected on the screen as well. Now And also I can change the fetal heart rate. So I will make it, now it's 140, I will make it 165, for example. So as you can see now, the numbers are changing. We have different factors for the contraction, where we can control the contraction frequency every how many minutes we need to do the contraction. So now it's on 3 minutes on the software. I'm going to change it to 1 minute, so we will have more contraction. I can also change the contraction intensity, the contraction duration as well. So you can see the changes on the graph already now. And also you can hear the sound. I'm not sure if you can hear it or not, but so I think by this we have covered everything for the two products that we were demonstrating today. First one, the Care in Motion, the recording system, with the easy setup portable solution, and the patient monitor from Gaumard, virtual patient monitor from Gaumard. If you have any other questions, I'm ready to answer.
Fine for me.
Thank you. Thank you. Bye bye.